Hey gang, trying to get the crew assembled for another video. Okay, I'm going to talk about hormones and hormone therapy tonight. Why do I want to do? Why do I want to change my hormones? I used to be very anxious. I used to be very aggressive. I used to be very angry. I used to be very restless. And I always thought that there was something missing. I guess now they call it dysphoria. So I wasn't satisfied with my life the way it was. And I thought from everything I'd read about hormones that maybe, I was also transphobic and didn't want to believe that I was trans. So I just believed that I had some kind of mental problem that I could fix with the right doctor or therapist. So I figured, you know what? Went and talked to a doctor that specialized in this kind of stuff. And I said, well, if I'm really trans and I take these hormones, am I going to feel good or am I going to feel bad? And he said, you're probably going to feel pretty good. And I said, if I'm not trans, am I going to feel good or am I going to feel bad? And he said, you're probably going to feel pretty bad. And we're probably going to know pretty quick that you don't really like being on female hormones. And I go, okay. All right, so maybe that's the litmus test. So this has all been an experiment for me. Now, I started out with an anti-androgen called spironolactone. And it was originally a hypertension drug, but they realized that it had characteristics that could benefit transgender people as well because it stopped your body from recognizing the testosterone that your testicles were producing. Okay, so he gave me some of that. And when my testosterone level had gotten down to about 200, he introduced me to an estradiol patch, which is synthetic estrogen. And it was a little sticky little patch that you put on your hip once a week, and it was a very small, low dose. And it brought my estrogen, it started to bring my estrogen levels up a little bit, but we slowly increased it. I said, you know what, this feels good. I think I'm on the right track. Let me have some more. And he said, well, you certainly can because your levels aren't dangerously high, so let's go ahead and do some more. And we graduated to a larger patch, and then we graduated to multiple patches, and they weren't doing any good. He knew they wouldn't do any good, but they weren't doing any good. So we had to, I craved more. I think I became addicted to it. And he put me on an injection. Now the injection is lots of fun. I do it intramuscularly, obviously, in my thigh. And I alternate thighs. 1 week it's right thigh, next week it's left thigh. I do it 7 days apart. I only inject myself once a week. Some people inject themselves twice a week with half their dose. Some people have a larger dose than I have. I have a dose that is right for me. And everyone will have a different dose. It depends on your metabolism. It depends on your body weight. It depends on what your hormone levels were already like. It depends on a lot of things, a lot of variables. I got what I need for me. I got it with a doctor. I monitor my blood every 3 months, and we keep those levels consistent. It took, because of my stupid experimentation phase, it took me 2.5 years to get them to where they should have been right off the bat. And that 2.5 years was an emotional roller coaster of emotional hell, seasoned with self-medication via alcohol and coping mechanisms that would make the devil blush. But for a year now, I've had my levels where they should be, and it's all good. I feel great. Has my body changed? Not so much. I used to be much harder and more angular in my shape, and now I am smoother and softer and a little rounder in my shape, but basically masculine shape. No one has noticed anything. My breasts have grown to a little bigger than an A cup, but I wouldn't call them a B yet. I don't know if they're going to get any bigger. I'm trying not to gain too much weight. Typically, on average, I think that trans women gain about 20%. And after they've been on HRT for a couple of years, or 20 pounds, I should say. I've gained about 12, and I think I can keep it at that. And I could probably, if I step up my game with my cardio a little bit, I could probably get it down, get my weight, knock that 12 pounds off. Okay. Well, one detriment to estrogen is that it craves sugar. And if you're going to eat more sugar than you used to, and you're going to have less testosterone than you used to, you're going to put on weight. And that's just the way it is. My hairline that was receding has come back, and and my 5 head has now become a 4 head. And it's flirting with possibly a 3.5 head. And that's kind of cool. My body hair has thinned and grows very slowly. And that's kind of cool. My skin has become softer and drier and appear to be a little bit thinner. And I bruise easier than I used to. But that doesn't bother me either. It's funny, you know, all of these things, as they occur and as I notice them, all of these little things that I'm getting, they always make me smile when I think about it. I guess I'm trans. The fat distribution on my body really hasn't changed. I've gained weight everywhere. My muscle definition is less because there's a lot more fat in between the muscles. I'm not that, you know, overall lean. Most of my weight has been around my belly. It's not on my hips. I have put on a little weight down in that area, but nothing to change my overall shape. I still wear the same clothes that I used to wear, the same male clothes when I'm presenting as male, and everything fits just fine. What I like the most about this is the emotional benefits that I've gotten from it. My anxiety's gone. My restlessness is gone. My bothersome sex drive is gone. It was kind of a pain and bothersome to have a sex drive that wasn't shared by my partner. And didn't have to be. I feel feelings. I feel emotions in other people. I'm becoming more empathetic, and if you would have told me that I'd be doing a video like this, or even talking to people out there in the hopes of helping them in some way 5 years ago, I would have laughed in your face. So I know it's changed me, and I'm happy with it. Now, I inject my estrogen, and I take my T blocker in a pill form. I've graduated to injectable estradiol or synthetic estrogen, and I put it in my thigh, and it's, you know, really the best and safest way to do it. Okay, it doesn't affect my liver as bad as anything you put in your mouth and swallow it. Is going to go through your liver. So, you know, having this stuff intramuscularly is better for me. All of this stuff that I'm taking could be life-shortening. And I needed to know that, and you need to know that. And any doctor that understands, that believes they understand the transgender condition and is willing to prescribe hormone therapy can do it, okay? But I suggest an endocrinologist or a doctor that specializes in treating transgender people, okay? My doctor is a family physician, but he's been treating transgender women for 30 years. He's treated, literally probably 1,000 or more transgender women, and he writes and he lectures on the subject, and but he's not an endocrinologist, but he understands what he's doing. He knows what he's doing. And I will go with life experience and on-the-job experience over schooling any day of the week. I'm not knocking endocrinologists. Obviously they're experts, and I'm not a doctor. So I had a demonstration of me injecting myself, but something happened with my camera, and the image flipped. And I don't want to post it on YouTube because I'm going to look like an idiot because I can't get the image to flip back. If anybody out there has any idea how to do that, let me know, because I can't. My editor can't figure it out either. Something with my phone. Now, if you're going to start hormonal replacement therapy before you hit puberty, you shouldn't be watching these videos. You're too young to be watching my stuff. But if you start hormonal replacement therapy in your teens and early 20s, you're going to see a lot more physical manifestation of the hormones than you do. Thank you, dear. You upstaged me. You're never supposed to go on camera with animals because they'll steal your thunder. If you start at a young age, it'll have better effect on your body. If you start at my age, not so much. So put something in the comments. Ask me some more questions. I'm sure there's a lot of stuff in here I can. Oh, we got trouble. I guess it's time to go. I gotta go outside. There must be a coyote running around. Love and peace to all, and let's just try to accept one another for who they are.